The Green Health Roots project was created by the Center for Sustainable Healthcare. Our Green Space team works closely with community organizations to make sure that local residents make use of their green spaces for health and well-being.
I think the thing I like about this walking group is that it gives me a reason for coming out.
The walking group is brilliant. It's a social group as well as a walking.
We work closely with health centers to encourage green prescribing. Green prescribing is the practice of health staff such as GPs and social prescribers identifying patients that would benefit from taking part in nature-based activities and encouraging them to access these resources. We work with GP surgeries to identify these patients and send them to our walking group, or also provide them with project resources that would help them be more active and especially be more active in green space.
One size doesn't fit all. There will be different benefits felt by different individuals. Going on a walk recommended by a social prescriber, a little walk around the neighbourhood. For somebody it's a change of scenery that they wouldn't have thought about, or perhaps they didn't know was there, and it could be really a positive, uplifting experience for one person who doesn't necessarily know why. It's just something they feel, or they may need time to process it and later on think, gosh, that walk was really, I feel really good after that. I would never have thought I could feel so good after going for a little walk.
So what would motivate you to come on these sorts of walks?
Well, mainly for my health, because I just think it's good to be out in the fresh air, and if you know you're meeting people, it's an incentive to get up and come along.
The project usually begins with the development of a community map that highlights walking routes that start at local community hubs such as health centers and libraries, and take people to local green spaces such as woodlands, parks and meadows, and help people identify the opportunities for enjoying nature and being active and socialize in these local green spaces.
The map is a great resource for patients. We have pads of the maps in all the consulting rooms and a massive map in the patient's waiting room. So the map means that patients are able to access the walks and do them in their own time if that's what they'd like to do.
Okay everybody, thanks for coming this morning. The route for today is to go down Cowley Road and along Barracks Lane into Cowley Marsh. Then we'll go along past the allotments and come back via Rymers Lane and the churchyard, and we'll finish up in the Restore Cafe over there. Okay?
Well, we find volunteers in the local community that want to lead the walks, train them up to become walk leaders and offer ongoing support such as helping to start the walks, first aid courses and any other support they require.
There are lots of ways in which the health walks are helping people in their community. A lot of people who have lived in the area for a long time and they've never explored fully, and we take them to places that, and they often say, well, I've lived here for ages, but I've never been here, never discovered this path, never discovered this green space. And they're really enjoying the fact that they've discovered some new places. As a walk leader, one of my biggest challenges has been finding ways to adapt the walk so that everybody of different abilities can take part in the walk. I always do a recce the weekend before the walk and then send an email round so that people are prepared. For example, if it's going to be on uneven ground, they might want to bring a walking pole. I try and vary it so that one week is a flat walk and one week is a hilly walk. And I've even, on occasions, just given options to the walks with mud ratings on each of the walks.
We work with local specialists to deliver exciting walks such as meadow walks, bee walks, bird walks, and these really help local residents get to know these green spaces better.
It's just nice to see nature and the trees and The beautiful flowers, that sort of thing.
Do you find you really notice that a lot when you're out?
Much more than I did when I used to walk on my own, yeah.
Yeah.
Because people are always saying, oh, look at the cowslips, and oh, look, there's a bird and a robin.
A lot of research shows that individuals who spend at least 120 minutes a week in green spaces have better well-being scores compared to those that don't. Being active in green space, and such as going for a walk, also provides individuals with many health benefits, such as reduced risk of experiencing many illnesses such as diabetes, cardiovascular diseases, Alzheimer's.
There's lots of physical and mental well-being benefits to the walks, but what we found is a lot of group cohesion, coming together, having a chat through the walk, and a tea and coffee is almost as important as the walk itself.
We go for a coffee afterwards, and quite honestly I think sometimes it's the chat and the coffee afterwards which is as important as the actual walk.
Definitely there's data to say that residents have become more active, and what we found is people change their schedule to fit the walks into their weekly schedule.
Obviously there is the physical health benefit, but much more than that is the uplifting. Being in a wonderful place like this, it's just fabulous. It lifts everyone's mood, it makes them feel better, and it's sharing these green spaces with each other as well.
Green prescribing projects have shown to be really sustainable and effective in providing patients with improved quality of life when compared to those that go through GP care alone.